Picture this. It's the middle of the night. You're battling an incurable terminal illness, and your body is racked with severe radiating pain. And yet, you have to drag yourself out of your apartment, onto the street, and over to a nearby gas station for one simple reason. You just need to use a toilet. Sounds like a scene straight out of some dystopian thriller, right? But this is the absolute unedited reality for a man named Matthew. We're going to dive right into this catastrophic collision of systemic failure, medical crisis, and sheer bureaucratic apathy that literally pushed one man to the absolute brink of survival. So, to really wrap our heads around the gravity of this situation, we need to look at what Matthew actually endured from June 2nd to June 6th, 2026. For 4 completely agonizing days, his apartment had absolutely no running water, no functioning toilet, and no bathtub. Nothing. This total lack of basic sanitation is exactly what forced him into those midnight gas station runs we just talked about, literally just to wash his hands and use the bathroom. It's a truly staggering level of forced indignity.
And what makes this even more striking is looking at Matthew's past. We're talking about a guy whose life was defined by resilience. For years, he worked as a highly skilled civilian, non-military government contractor. He deployed to incredibly dangerous combat zones in the Middle East, navigating some of the most hostile environments on the planet. But today, well, he's partially retired, forced to step back because he's battling an incurable terminal illness. So the guy who survived global combat zones is now fighting a completely different, deeply domestic war right at home.
Now, here's an absolutely crucial piece of the puzzle: who he's relied on during this health battle. For 16 years, over a decade and a half, Matthew has entrusted his life and his highly sensitive medical care to a massive nonprofit organization called the AIDS Health Foundation, or AFGH. For 16 years, they've been his trusted healthcare provider. They dispense the treatments that keep him alive, they know his chart inside and out, and they know exactly how vulnerable his condition makes him. Which brings us to a frankly cruel bureaucratic irony. You see, AHF isn't just his healthcare provider. They are actually the parent company of the Healthy Housing Foundation, the group that owns and manages his apartment building, the Dallasonian. So the very same organization entrusted with his clinical survival is acting as his landlord. On paper, that sounds like it should be the perfect sanctuary, right? But in practice, it became an absolute trap. To really grasp why this housing situation turned so lethal, we have to look at this number, 2. Because of his terminal illness, Matthew's immunocompromised status is incredibly severe. His CD4 count, those are the white blood cells that act as your body's defense system, is at a dangerously low level of 2. To put that into perspective, a normal adult has anywhere between 500 and 1,500. A count of 2 means he literally has no immune system left to fight off even the most minor infections. Section 1. The bureaucratic death spiral. Administrative asphyxiation. So, how does a massive healthcare nonprofit end up endangering their own patient? Well, it starts with them dragging their feet on something as simple as installing a functioning metal mailbox. Let's trace this domino effect. Matthew moves into the Dallasonian in May 2025. Management totally fails to provide secure mailboxes, just leaving mail in chaotic piles. Because of this negligence, when his highly critical Social Security disability insurance recertification paperwork arrives in November, he never even sees it. And bureaucracies don't run on empathy, they run on algorithms. When the system doesn't get a response, it assumes you're just gone. So by January 2026, his lifeline, his disability benefits are abruptly and automatically canceled. Now, Matthew didn't just give up. He aggressively fought back. He immediately filed an appeal for review with an administrative law judge at the Social Security Administration. But here's the terrifying reality of the system. That grueling legal wait time takes months to years. And even if they reinstate his benefits, there is absolutely no guarantee he will ever get the missed payments that were taken from him. He's just left entirely in limbo. Let's look at what that actually means on a practical level. When his benefits were terminated, Matthew suffered a devastating 80% drop in his total income, pretty much overnight. It was a massive financial cliff, and it was engineered entirely by a missing mailbox at his own apartment complex. With only 20% of his income remaining, he obviously couldn't cover his rent. And how does his landlord, who, remember, is also his healthcare provider, react to this? By weaponizing rigid lease agreements. Instead of treating this as a systemic crisis that they literally helped cause, management locked him out of his digital tenant portals.
They applied rigid mechanical failure clauses to what was rapidly becoming a severe medical emergency, essentially treating a vulnerable, terminally ill patient like a delinquent tenant trying to game the system.
Section 2. A lethal biological threat. The June eruption. With his income destroyed, the physical environment of his apartment suddenly turned deadly. A horrific, raw sewage backup erupted, completely saturating his carpets and contaminating every single surface in his bathroom, the tub, the toilet, and the sink. Remember those 4 days without running water we talked about earlier? Well, desperate to clean himself in an apartment off-gassing human waste, Matthew was forced to take a lethal bath. As he poured water into the contaminated tub, the steam actually created an aerosolized bacterial fog. This resuspended biological soup easily breached his body through the permeable mucous membranes of his eyes and mouth, and even through microscopic fissures in his skin. And remember, he has no immune system to fight back. That forced vulnerability led directly to a terrifying diagnosis. The bacteria from that raw sewage entered his bloodstream, causing high B bacteremia. This is a severe, potentially fatal bacterial bloodstream infection. For a man with a CD4 count of 2, this isn't just a simple illness. It is a universally fatal event without massive, immediate intravenous medical intervention.
Section 3. Hospitalization and systemic shock. Fighting for survival.
At the hospital, Matthew rapidly descended into systemic septic shock. The staff literally had to fight tooth and nail to save a man poisoned by his own apartment. Against all odds, he survives the acute phase, which brings us to a critical timeline marker. June 21st, 2026. He is officially discharged and released from the hospital. But guys, this isn't a happy ending. This date sets up the grim reality of what this immunocompromised survivor was actually sent back to. Section 4. Returning to the danger. The chilling present reality. He survived the hospital, sure, but he had to return to ground zero at the Dallasonian. And the negligence he's facing right now is absolutely shocking. For 7 full days prior to his release, Matthew contacted his landlord, AHF. Their response? Complete silence. Nothing. That unremediated biohazard contamination? It still exists. It's still deeply saturating the carpets and every surface of his bathroom, including the tub, toilet, and sink. They haven't sent a single person to clean it. When he requested alternative accommodations, like a new apartment with functioning running water, a toilet, and a bathtub, or even just a clean hotel, they outright refused to address it with him. And to make matters even worse, emergency building-wide inspections have already happened, yet management still hasn't reached out to him. Oh, and they are scheduling multi-day water shutoffs for the entire complex next week. Which leaves us with this final incredibly provocative thought. A massive organization, acting as both healthcare provider and landlord, engineers a crisis over a mailbox, causes a man to lose his income, and then leaves him to bathe in raw sewage. So the question you really have to ask yourself is, how can a massive healthcare nonprofit possibly justify abandoning their own terminally ill patient in a lethal biohazard zone? It's a staggering systemic failure, and a story that definitely demands we take a very hard look at the institutions we're trusting with our lives.